Today, we're going to talk about electronic health records, or some people call them electronic medical records. So, EMRs or EHRs in private practice. Now, this is always something that is very interesting. And the reason is because I own a medical billing and credentialing agency. And I always like to explain some of these things because a lot of times I will come into different practices and they will have certain EHRs and EMRs that sometimes make me cringe. And I will tell you why. It's You've got to make sure that you pick something that makes sense. So let's kind of go over, the 5 things that I talk about a lot of times in with EHRs and EMRs. So number one is cost. If you have just started your business, I really recommend that you start with something that is not costing you a lot of money. The reason is because you don't have a history yet. You don't know how much revenue you're going to have. You also don't know when maybe the insurance is paying. You don't know a lot of things. And once you have measurable data for your revenue is when you should start thinking about getting certain EHRs that might cost a little bit more money. Now, some people like to start off the bat and start with, kind of like the big boys, and that's fine. That is all about what you can actually handle in your budget. But if you are starting lean and you don't have a lot of money to start with, I suggest that you look at an EHR or EMR that you can afford, whether you have clients or not, because you don't want this to be an issue. Okay. The next thing about EHRs and EMRs that a lot of people don't really talk about is you have to build these platforms. Okay. I'm going to say it again. EHRs and EMRs do not come already created. Therefore, if you're an LCSW, you have goals and objectives, you have different things that you need for, like individualization for your patient, fee schedule. How much are you going to charge? Admin fees, are you going to charge for no-show fees? Just all of those things that you enter in at the job that you might have right now, that was all inputted and created in the EHR. I need you to understand that. So many times I have walked into private practices and they say that they are ready to bill and they are not. Why? Because their EHR or their EMR is not built yet. You have to build that system. Nothing comes in there. Now, there are some platforms that do have some populated items for you that you can use that are templates, yes, but you have to make them yours. They're not yours until you put your logo on them, put your rules and regulations of your clinic and private practice. So you have to build your EHR. Nothing comes within them. Okay. The next thing is, as someone who works with billing and credentialing with private practice, please make sure that your or EMR has a billing system that is connected to it. I'm going to say this again. Make sure that your EHR or EMR has a billing system that is connected to it. If it does not, it's going to be very difficult to bill. And there's a lot of ways that there could be human error from your EHR to another system to go ahead and bill it. So I will give you an example. Right now, we bill for a couple different private practices. And what is very interesting is they do not have a billing system. And since they don't have a billing system, what that means is that we have to take the data from one system, download into that other system, then move it back out from another system, meaning the clearinghouse possibly, okay, and then get it to the insurance company. That is a lot of work, which means that your billing team is probably going to ask you for more money. That's number one, because that's a lot of work. Number two, you're putting a lot of room in for human error. People are humans. So that moving that data from one point to the next is a human, right? So if they're tired, if someone interrupts them, if somebody calls in between, there could be a claim that is left there, or there could be a claim that is not uploaded. Okay? So if you look at this, right? So your EHR is here, then you have to go to another system, then the other system gets to the insurance company. Then this is what happens again. The insurance company pays or they denies. You see this at the insurance company. It goes back into another system. Then it has to be payment posted into the other system. That is a disaster. And I do not recommend that, but that's something that you really want to look at. Does your EHR system have also the capabilities of billing out of another system? Here's the other very, very interesting thing about EHR systems. Some EHR systems actually charge you a percentage. I am not talking about credit cards. I'm not talking about that. I am actually talking about, go out, please. I'm not talking about credit cards. I am talking about, actually doing bills, right? Actually creating those bills. It's very, very important that you understand that percentage, right? So I've seen some EHRs just as high as 8%. 8% in percentage just by moving your claims in and out of that system. Well, what if you have a billing team that's also charging 3, 4, 5%, right? So let's say we've got 8%, and let's say it's even 4, just to make it very easy numbers. That's 10% that's coming out of your pocket before anything has even really been done, right? And that's just your EHR system. So I encourage people to get an EHR system that actually has like a flat rate, okay? Because those percentages can get really high and people have so many questions about what's happening, and it doesn't work. It doesn't work. But if that's what you want, that's what you want. Also, money. Now, this is so interesting to me. So, let me give you an example. If I was working somewhere and I don't know, I'm mowing the lawn. I have a lawn service. I go out, I mow the lawn, and the person is going to pay another service, and then that service is going to pay me. Okay? So a lot of places are doing this. I'm not going to name these EHR systems. I would recommend not to allow an electronic health record or an electronic medical record to take my money, meaning having the electronic remittance advices and the EFTs going into their system, and then they take out their percentage and then they pay you. I'm very confused and concerned on why some private practices are allowing EHRs and EMRs to pay them when really insurance companies are supposed to be paying you directly, and then you pay your bills. I really want you to think about that. That is not helping you. That is helping that EHR and that EMR as a business, but that's not helping you as the business of the provider. This also creates several other issues, which is revenue flow. That revenue flow is not only, so the insurance company is going to pay the EHR because the EHR is going to take the electronic funds transfer for you on your behalf, and then it's going to pay you one lump sum. I really want you to think about this. If that happens, that slows down the process. So let's say that they pay you on the first, meaning the insurance company paid the EHR on the first. Who says when the EHR is going to go ahead and take their percentage and then pay you, right? We have to think about that. So I wouldn't allow an EHR to take my hard-earned money and then take out their cut and then pay me. So I want all of you to really think about that. And there's a lot of really large EHRs that do that. Now, if that's what you like, then I love it. But I do know that it could, you don't know if that's right or wrong, or the percentage that they're taking is correct, right? It's your money. The insurance company said they were going to pay you. So why give it to the EHR or EMR first and then them? So I will end this live, but again, cost, percentage, it is not populated. How much is the EHR? And then how do you get paid? You have to think about all of these things. It's so important. All right, go to yougrowhealthcare.com, and I hope to see you at my webinar. All right, have a good day.